Top prediabetes symptoms you must avoid.
Hi guys, welcome to my channel. Before we get started,
make sure to hit that like button, also subscribe to my channel. Top prediabetes symptoms you must avoid. So make sure to watch the full video. What is prediabetes? Prediabetes is a warning sign that type 2 diabetes, T2 German marks, affects 1 in 10 American adults, and you could develop the disease in the future. Usually this means that your blood sugar is higher than normal, but not high enough for a type 2 diagnosis. Prediabetes without serious symptoms. Think of it as a call to action. The way I explain prediabetes to patients is that your body is working hard to keep blood sugar in a healthy range, says dietitian Lauren Antonucci. You shouldn't panic, but you need to start making real changes to your diet and lifestyle to prevent your blood sugar from rising and turning into type 2. What causes prediabetes? Insulin is a hormone produced by the pancreas that helps your body turn glucose into fuel when you eat. The carbohydrates in your food are converted into glucose, also known as blood sugar. Glucose stays in your blood until your pancreas releases insulin. Acts like a key that opens your cells to let in glucose, which is then used to fuel your body. Without insulin, or when insulin doesn't work as well, glucose can stay in your blood and build up, causing your blood sugar levels to rise. During type 2 diabetes, your pancreas still produces insulin, but the insulin gradually becomes less effective at helping glucose get into your cells. Prediabetes occurs when your body begins to stop using insulin as efficiently as possible. In other words, your body has developed insulin resistance. When your body resists insulin, your blood glucose levels rise, which is how you develop prediabetes, and, if you don't stop and let it go, type 2 diabetes. Symptoms of prediabetes. If prediabetes is easy to spot, you're not going to let people go year after year before they're diagnosed with type 2 diabetes, Antonucci said. Adults often have no symptoms, or the symptoms of insulin resistance are so slow or mild that they may go unnoticed for years. However, sometimes there are warning signs. These include increased thirst, increased hunger, fatigue, unexplained weight loss even though you eat more, frequent urination, the last symptom of your blood causing blood in your body. Flush out the glucose. The more you urinate, the more likely you are to become dehydrated, which can lead to a cycle of increased hunger and thirst signals. Symptoms of diabetes in men can also lead to sexual problems, such as erectile dysfunction, ED, and loss of libido. Dark skin on neck. According to the American Academy of Dermatology, dark patches or bands of velvety skin on the back of your neck, armpits, groin, or elsewhere may mean you have too much insulin in your blood. Other skin problems that may indicate unresponsive prediabetes or diabetes include patches of yellow, red, or brown skin that are firm, itchy, or painful. Thickened skin on the fingers, toes, or both. Sudden blisters. And red, yellow bumps that look like pimples but are very itchy. How do doctors diagnose prediabetes? Diabetes mellitus is a measure of the amount of sugar in the blood. Doctors do this in two different ways. 1. Standard blood glucose test. This requires you to be fasting before the blood test so that your PCP or endocrinologist can still check your blood glucose levels. Ideally, your fasting blood sugar should be 99 mg per deciliter or less. If your fasting blood sugar is between 100 and 125 mg per deciliter, you may be considered prediabetic, says Martha McKittrick-Rode. I like that people do a second test to make sure it's accurate. She said a value above 126 mg per deciliter indicates diabetes.
2. A1C blood test.
The A1C or HbA1c test is a non-fasting blood test that measures the average amount of glucose in the blood over 3 months and expresses it as a percentage. A healthy percentage is less than 5.7%. Results between 5.7% and 6.4% indicated prediabetes. Anything above 6.5% indicates diabetes. People with prediabetes may not always have symptoms. In fact, most people don't. Usually, asymptomatic people are only diagnosed with prediabetes if their GP tests them for blood sugar or checks their HbA1c readings and finds an atypical result. Therefore, one of the most important things you can do is get an annual blood test. Your blood test can tell you if your blood sugar was too high and you were on the right track before you developed type 2 diabetes, says Antonucci. Although most people don't have obvious symptoms of prediabetes, if you experience fatigue, excessive hunger, excessive thirst and frequent urination, prevention is better than cure.
Make an appointment to check your blood sugar as soon as possible.
What are the risk factors for prediabetes? Your risk of developing prediabetes increases when you have any of the following conditions. Unhealthy diet. A diet high in sugar and processed foods raises your blood pressure and raises your LDL, or bad cholesterol, levels. You are at risk for prediabetes. Overweight. If you are medically overweight, you are at high risk of developing prediabetes. This is especially true if you have a lot of extra weight around your belly, known as visceral fat, which can play a role in insulin resistance. A sedentary lifestyle, extreme inactivity, can lead to insulin resistance and weight gain, both of which can lead to prediabetes. Aim for at least 30 minutes of walking a day, even if it's just a walk. Family history of type 2 diabetes. Prediabetes has a genetic component. If a member of your immediate family has T2D or has had T2D in the past, you yourself are more likely to develop prediabetes and type 2 diabetes. Your race and ethnicity can also affect your likelihood of develop prediabetes. There is a genetic component, but studies show that racial differences in people who develop diabetes have more to do with socioeconomic status and the availability of health care and healthy foods in your community than with your genes. Advanced age. The older you are, the greater the risk. At age 45, your chances of developing prediabetes begin to increase. At retirement age, nearly 25% of people over 65 will have prediabetes. Is prediabetes reversible? Absolutely. You can reverse prediabetes with lifestyle changes, including assess food choices for the best chance of long-term success. Work with your nutritionist to create a meal plan that still includes your favorite foods, but slightly different if needed, so you don't feel deprived and I can stick with it for the long haul. For example, replacing white rice with cauliflower rice as an accompaniment to your everyday meals, or replacing zoodles made from squash or other vegetables with pasta so you can still enjoy of your favorite recipes, in order to reduce the starch content. Exercise is a great way to reverse prediabetes for a number of reasons. First, a fitness diet can help you shed the pounds that increase your risk of prediabetes without dieting. Also, when you exercise, your body uses more glucose, which helps remove it from your blood. Finally, exercise activates a cellular receptor called GLUT4. The American Diabetes Association recommends at least 150 minutes of moderate physical activity per week, usually an average of 30 minutes 5 times per week. But if you know you're too busy to train other people, you can also break it up into longer workouts on days when you have more time. Weight loss. If your doctor medically recommends weight loss for prediabetes and you don't know where to start, or you've tried everything diet-wise and nothing works, get some weight loss aid. Losing just 5 to 10% of your body weight can dramatically reduce your risk of type 2 diabetes and eliminate prediabetes. So if you found losing weight in the past to be too difficult, invest in a nutritionist and trainer. Health programs pay for diabetes education and physical therapy, and your doctor can work with you to provide the services available to help you succeed within your budget. No insurance? Nutritionist recommended apps like Chronometer and Mindful Eating Tracker, $2.99, can take calorie counting out of your mind and teach you what you're eating while helping you make better food choices. Medications. If you are at very high risk of developing type 2 diabetes after being diagnosed with prediabetes due to comorbidities such as obesity, your doctor may recommend a medication such as metformin, which prevents the liver to produce more glucose. Necessary so that your blood sugar remains in a safer range. What are the treatments for prediabetes? Depending on your blood sugar at the time of initial diagnosis, your doctor may choose to prescribe a drug or combination of drugs to bring your blood sugar back to a healthy level. The use of drugs to treat prediabetes is not set in stone, says Antonucci. Your blood sugar, A1C, medical history and other complications may put you in a situation where you need to add medications to your treatment plan to avoid type 2. It's on a case-by-case basis. So work with your doctor to determine the best treatment plan that comes to you. What is a pre-diabetic diet? The diet for prediabetes is very different from the typical American diet. I like to tell my customers to reserve half their plate for vegetables, a quarter for protein and a quarter for healthy carbs like whole grains and fruit, says McKittrick. People with prediabetes should avoid processed carbohydrates high in sugar and instead consume carbohydrates, in moderation, from whole grains, fruits, legumes, and starches. What do you think of our video? Let me know in the comments section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go.